Hello all, in this short video, let us not only discuss but also remember thanatophoric dysplasia by heart by the end of this video because it's the most important spotter that we need to know. Thanato meaning lethal and phoric meaning bearing, so it's the most common lethal dysplasia. The characteristic features are rounded up, which we are going to learn in the form of a mnemonic. The term thanatophoric dysplasia, TH, stands for telephone handle femur, and the second letter H stands for head-shaped vertebra, that means platyspondyle. Platyspondyle meaning flattened vertebra, and A is for trident acetabulum. In the word thanatophoric, we have two O's indicating skull. Usually the skull is O, that means rounded shape, but here we have clover leaf skull, which is the last letter. So clover leaf skull. In between, we have two letters PH indicating polyhydramnios. So thanatophoric dysplasia is associated with polyhydramnios. The characteristic features are underlined: telephone handle femur, head-shaped vertebra, trident acetabulum associated with polyhydramnios, and clover leaf skull. The first two characteristics like large heads and short ribs are seen in most of the skeletal dysplasia. So we do have to remember the characteristic ones to get to the diagnosis of the spotter easily. Thanatophoric dysplasia is of two types. Type 1 is first F for femur, that is telephone handle femur. Type 2 is the mirror image of S, so skull, that means in type 2 we have clover leaf skull. Now let us read the radiographs provided. The first image is showing large head, that means frontal bossing is seen, and we also see the short femur, that means bowing of the femur, telephone handle femur. The image, zoomed up image, is showing the curved or the bowing of the femur, which is telephone handle femur. In between vertebra, there is flattening of the vertebra, as well as the ribs are short in this case. Now let us see the images of the vertebra, which are showing platyspondyle, that is flattening on the lateral view, and on the AP view you are able to see the head shape of the vertebra because of the flattening. And the last image is showing the antenatal ultrasound of cloverleaf skull, posteriorly broadening and anteriorly narrowed skull can be seen in the antenatal scans. 2 for S, that is type 2, and first femur is seen in type 1 of thanatophoric dysplasia. Coming to a few important points. It's the most lethal congenital dysplasia, autosomal dominant FGFR3 gene mutation, type 1 F femur, telephone handle, and type 2 is skull, clover leaf shaped skull. So hope this summarizes thanatophoric dysplasia for you in a nutshell. Thank you.